Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Norma Basalis. And here at the side you can see the diagrammatic representation of Norma Basalis on inferior view of skull showing different important landmarks or parts here for the reference. So let's start our topic with introduction. Norma Basalis refers to inferior view or basal view of the skull as seen from below. It presents the external base of skull, revealing a complex arrangement of bones, foramina, ridges, and articulating bones. This view is essential in neuroanatomy, surgery, and forensic medicine for understanding cranial base pathways. Let's talk about what are the bones visible from Norma Basalis. This view displays parts of six major bones. They include occipital bone. That is the posterior part. Here in diagram you can see the green color bone is occipital bone. It includes the foramen magnum. Next is temporal bone. Here you can see in diagram the green color bone is temporal bone. It is present laterally and include mastoid and petrous parts. Next is sphenoid bone. The yellow color bone you can see in diagram is the sphenoid bone. It is centrally located. It is butterfly shaped. Next is vomer, as you can see in the back side of the palate or at the area of coronae. It is a midline bone that form part of nasal septum. Next is palatine bone. You can see in diagram the palate posterior part, the orange color bone is the palatine bone. It is posterior hard palate. It forms the posterior hard palate. Next is maxilla, that is anterior pink color bone. You can see is maxilla. It is anterior. It forms anterior hard palate and upper dental arch. As you can see here in the diagram, the all of the upper teeth are present in the maxilla. Now let's talk about key features of Norma Basalis. Norma Basalis is famous for its numerous critical opening. Here are the most important ones. First is foramen magnum. As you can see in here in diagram, the largest opening in the blue color bone or occipital bone is the foramen magnum. It is the largest opening. It transmits spinal cord, vertebral arteries, and accessory nerve. Next opening is jugular foramen. You can see here in the diagram. It transmits internal jugular vein, cranial nerve number 9, 10, and 11. Next we have is carotid canal, that is passageway for internal carotid artery. Next we have is foramen ovale, that convey the mandibular nerve and small arteries. Next opening in Norma Basalis is foramen spinosum that transmits the middle meningeal artery, and next is stylomastoid foramen that is exit way for the facial nerve, that is cranial nerve number 7. Next we have is incisive foramen that is behind upper central incisor, as you can see here in diagram. It allows passage for nasopalatine nerve and vessels. Now let's talk about notable structures that are present in Norma Basalis. First is hard palate. As you can see in the diagram, anterior part is hard palate. It is formed by palatine process of maxilla, that is anterior 3-4 process, and the horizontal plates of palatine bone, that is posterior 1/4 of the part of the hard palate. It separates oral and nasal cavities. Next is zygomatic arch. It is lateral to the cranial base. It is formed by temporal and zygomatic bone. Next is occipital condyles, that are smooth oval projection that articulate with the atlas, that is C1 vertebra, that is vital for head nodding movement. Next is pharyngeal tubercles, that are small midline bump anterior to foramen magnum, that is the attachment for the pharynx. Now let's talk about clinical and surgical significance of Norma Basalis. First is cranial base fracture that often involve the foramen magnum, sphenoid, or temporal bone. Second is base of skull tumor aneurysm that may impinge on nerve passing through these foramina. Third is important surgical approaches like transoral or endoscopic endonasal approaches are based on this view. Now let's talk about conclusion of this lecture video. Norma Basalis is the high interchange of the skull, dense with anatomical pathway, nerve exist, and vascular gateways. Understanding this underside of the cranium is key to decoding how the brain interfaces with the rest of the body. And this was all about Norma Hospitalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.